And back now, Sunday House Call in our weekly segment, Should I Worry?, in which we talk about everything that worries us, and that could be a lot. One viewer writes, my doctor found protein in my urine. Should I worry? Dr. Siegel, what does that mean?
Well, this is, first of all, a great one for me and David. You know why? Half of the things that cause protein in the urine are on my side of the fence, and the other half are on his side of the fence, urology. So before I throw it to him, I want to say that a lot of the time you don't have to worry. A lot of the time, maybe you're dehydrated, maybe you've been exercising too much, maybe you have a urinary tract infection, and that's causing it, which is easy for us to treat. But if it persists, or if it's a lot of protein in the urine, and when you dip the urine with we dip the urine with a stick, and we look at the amount of albumin, which is protein in the urine. We look at how much there is, and the more there is, the more we worry. And then we have something called a sediment. Are there cells in there? Are there white blood cells? Is there blood in there? Because if there's blood in the urine, and that's causing the protein, a lot of things can cause the protein.
Is this kidney, or what could it be?
Well, that's what I'm getting at.
Okay.
If it's blood in the urine. I worry that it could be bladder cancer, it could be coming from the kidney, it could be kidney stones, could be prostate. You know, I worry about that. It could be an infection if it's white blood cells. It could be the kidneys themselves. The two things I see the most are diabetes interfering with kidney function, causing protein, and high blood pressure causes protein. Because again, these impact the function of the kidney. Kidney doesn't work as well, it starts to spill protein. If I really worry, I do a 24-hour urine study to see how much protein.
Right. Okay, so then what should we be looking out for then in order to know to go to the doctor and even have our urine tested for this?
You would have absolutely, a lot of times you wouldn't have any signs and symptoms at all. So this is when you come for, unfortunately, you're going to end up in my office because that's what we do. You get a urine test, and with a dipstick, you're going to find out that there's some protein. First time around, it may not be as important, and you repeat the test. It's really the sign of kidney disease. That's what protein in urine means, and you have to be careful about that. What kidney does, it really gets the blood, gets all the good stuff back in the system, and gets rid of all the waste. That's what kidney is, a filter. When you have kidney damage, whether it's part of a syndrome called nephrotic syndrome, that's a whole syndrome that you would see protein in urine, or you may be taking a CAT scan, and the CAT scan has contrast, affects your kidney and can have kidney damage, chronic kidney disease, or you take some IV antibiotics that affects your kidney. All of these, whatever it is, diabetes, high blood pressure, that can cause kidney disease. Now the filter doesn't work well, and you start spilling all the good things. You see sugar there, you see protein, you see those things. So what we do is we start treating the high blood pressure. The patient goes back again to the nephrologist, to medical doctor. You have ACE inhibitors, fix the diabetes, but so knowing and screening is the most important thing for you to know.
Screening is always
it's
so
very
crucial.
vital.
Should you get like a urine test like every year?
Well, when you come to your medical doctor, certainly in the urology office, that's the first thing we do. You give a cup,
every year when you
and you get a dipstick. That's right.
Okay.
And in that dipstick, Eric, you would see whether there's any blood or sugar or other things. You get the whole gamut of information.
Once
that's
a year
important.
or more than that?
I think that's an extremely important point you just brought up, because you know what? A lot of doctors were so keen on the blood tests, we forget to do the urine. And urine is another way in, like we say, the eyes are a way in to see what's going on in the body. The urine tells us protein in the urine is a sign that that kidney is not functioning properly if it persists.
And then you can get the 24-hour urine.
That's right.
You can find out exactly what's going on with you, whether it's changed by diet or not, or exercise,
I know,
and
you
on
always
and
feel
on.
like embarrassed to get that little cup, and then you want to make sure they put your name on it.
Not in the urology
you know.
office. You don't have to worry about it.
Good.